So Brian and Heather, what are some tips you have for our faculty for being ready to go with a virtual clinic or virtual patient encounter when you have a resident or medical student with you?
Okay, I guess I'll start. I kind of think about it in two different ways. First of all, you want to make sure you have the right equipment to ensure that your patients can hear you and see you. So making sure that your computer is capable of video conferencing. So that means making sure that it has a front-facing camera and a microphone. Also, you want to make sure that you have a reliable internet access. So once you have those kind of hardware pieces put together, you want to then optimize the whole situation, how they operate. So you want to make sure that your Wi-Fi is optimally working. So that may mean restarting your modem or your router. It may also mean upgrading your internet if it's, slow or more meant for, say, email browsing or that sort of thing. You may need more capability for video conferencing. You may also need to restart your computer. So many of us have 8 million applications open, and that can slow your computer down and make it difficult for your computer to process all the video and audio. So just do that beforehand. You want to make sure that you have tested the microphone and the speakers ahead of time. So Zoom has a way of testing that ahead of time. So you can go to zoom.us/test to look at that and make sure that you kind of problem solve ahead of time. Many people recommend that you have either like earphones like myself that has an external microphone. That makes it a little bit easier for patients to hear you as well as for you to hear your patients. So those are some things that you can do there. And then you want to optimize kind of the background so they can see you well. So making sure that you're not set up in front of a window. Conversely, you want to make sure that, you have good light kind of shining on you as well so they can see your eyes and mouth, and in case they need to do a little bit of lip reading as well. Make sure the background is fairly simple as well, so that you can be easily seen and can use some of your body language as well during your video conferencing. And then lastly, you want to make sure that your camera is at least eye level, and that's not looking up your nose or on top of your head, or some of these situations where you're looking just at their eye or forehead. So doing whatever you can to make sure that you kind of frame the camera as best as possible.
So this would not be an ideal setting if I was seeing a patient in this manner?
It could be okay.
It's not ideal, Jamie.
I get the patients that are like, yeah.
That can happen.
Yeah.
Heather, are there any particular tips that you give residents before they start a virtual encounter?
So one is to familiarize yourself with the Zoom platform. So as Brian alluded to, you can test your audio and video, but you can also learn the screen of Zoom and what you are able to do throughout it. It is also good to, like I would do in person, always discuss the patient with the resident and what the expectations are for that interview. If there are time constraints, you need to be specific on how much time the resident can have with that. And usually we'll do that via a waiting room function. So that myself and the resident will meet first to talk about how the encounter is going to go before admitting the patient into the encounter.
Great.
The other thing I would recommend is that there's always technical issues. So it is good to ensure that you have a phone number for the patient, that you can reach them in case they are having audiovisual issues or if you get disconnected. And then just be familiar with the patient's chart prior to entering the appointment.
Perfect. A couple other tips people have brought up for me in the past is, number one, the phone number, as you mentioned, but also knowing where the patient's physical location is. So that's something I ask from either our clinic coordinator or secretary, is to make sure that they let us know where the patient plans to log in or sign in from, so that in case of any emergency or acute medical event during the session, we're able to then activate a system or get somebody out to them if necessary.